My name is Taylor Watterson, a practicing pharmacist and PhD candidate at the University of Wisconsin-Madison School of Pharmacy. I'm excited to share with you my 2019 pilot project regarding subjective and objective assessment of pharmacist fatigue. Pharmacists are doing a ton behind the counter beyond just putting pills in a bottle. Pharmacists are the last line of defense against the 4 million negative medication-related events that occur yearly. Pharmacists are doing remarkable things, but they're doing them with incredible strain in their workplace. 3 out of 4 community pharmacists report their workload levels as high or excessively high. This is because they're often working for 13 to 14-hour-long shifts at a time, often standing and often without breaks, even for lunch. Occupational fatigue is a serious concern previously studied in other professions like nurses and physicians, long-distance truck drivers, and air traffic controllers. Occupational fatigue is a characteristic of excessive workload that inhibits workers' abilities to function at normal capacity. We know from previous studies that pharmacists are self-reporting these feelings of fatigue and even burnout and excessive workload, but this study was the first to quantify and objectively measure fatigue in pharmacists. We specifically wanted to capture the objective occurrence and severity of fatigue in pharmacists using a wearable device, kind of like a Fitbit. We also compared this data to a self-reported survey. But for today, we're just going to talk about this first aim. In this study, we were interested in community pharmacists. Think of your corner drugstore, retail pharmacy, companies like Walgreens or Medicine Shop, and even pharmacies inside of big box stores like Walmart or Costco. This would not be your pharmacy inside of doctors' offices, clinics, or hospitals, but retail establishments with access to patients. We recruited 20 community pharmacists to participate in this study. And we measured fatigue by giving them a wearable actigraphy device, specifically the Fatigue Science Ready Band. This device and technology was developed by the United States military and has been used and researched in heavy industry, military, and even elite athletes like the NHL and NFL. The technology does this by using wrist acceleration and time of day to calculate things like circadian rhythm, sleep quantity and quality, and most interestingly for our study, mental effectiveness. It's a percentage of what maximum capacity you're working at. They call this a ready score. So we gave this band to our 20 pharmacists and asked them to wear it for 24/7 for 14 days. After 2 weeks, it provided us with data like this. We can see it provides us with sleep quantity, quality, awakenings, and some specific times. But once again, we see it provides us with an average ready score, or effectiveness. This image is only for a small subset of our sample, but our entire sample, our average ready score was 91.06, with a standard deviation of 3.65, which is pretty good. Now, as you can imagine, there can be quite a range over time. We see these peaks and valleys for a small group of our participants over a several-week interval. This technology can go even further and provide us minute-by-minute data for our individual participants. But what we wanted to know are the dips. How often are our pharmacists at these fatigued states? So the fatigue science model tells us that when a ready score is less than 80%, an individual's reaction time is slowed by 34%, the risk of serious accident or error is elevated, and they're performing at a slightly elevated blood alcohol content. Our pharmacists spent on average 5.87% of time in this area, but it was a wide range. Some spent 0, while others spent over 40% of their time here. But let's take it one step further. When the ready score is less than 70%, our reaction time is further inhibited, our risk for serious accident or error is high, and our blood alcohol content is that of when we're legally considered too drunk to drive. Our participants spent less than 1% of time here. So what does that tell us? It tells us that there's some variability across our community pharmacists. We tried to figure out what may be describing this variability by comparing the ready scores across different subsets, whether or not the pharmacists had scheduled breaks, males and females, and even whether they worked for an independent pharmacy or a chain establishment. We found no difference. Which leads us to our next steps. Repeating the study in a larger, perhaps more diverse sample to be able to tell us the fascinating story of pharmacist fatigue. They're the last line of defense before a medication reaches a patient, and so we owe it to them to consider their health and well-being. I want to say thank you to the Midwest Center for Occupational Health and Safety Education and Research Center for funding this project. It represented a great opportunity to demonstrate feasibility and provide guidance for our next steps. We're anxiously awaiting council review for a federally funded AHRQ R36 dissertator grant. This pilot was the first step to a more robust measurement of fatigue in an industry that has been previously understudied. I look forward to your questions and furthering the discussion during the live Q&A session.